Hi, my name is Kyla and I'm a student registered nurse from Western Sydney University, and I'll be looking after you today. So I've just read your patient notes and it says that you've been having pain, am I correct?
Yes.
Yep, so I'm going to give you some medication for that. But before I do that, I just need to confirm your patient details. So could you tell me your full name and your date of birth for me?
Kane Dobson, 31st of March 1994.
Okay. I'm just going to check your medical record number as well. So 0956742. Yep, perfect. And do you have any allergies, Kane?
Yes, penicillin.
Okay, and what reaction do you get to penicillin?
My face swells.
Okay, no worries. So for your pain, could you tell me what time it started?
This morning,
This morning. And from 1 to 10, 10 being the worst, how would you rate your pain?
6.
A 6 out of 10?
Yes.
Yep. And whereabouts is the pain?
In my chest,
In your chest, and does it radiate anywhere?
in my shoulder.
To your shoulders? Okay. And how would you describe this type of pain? Is it throbbing, piercing, sharp or crushing?
Sharp.
It's a sharp pain. Yeah. And does it hurt when you move or mobilize, or when you're at rest?
When I do deep breathing,
When you do deep breathing. Okay. So, Kane, I just need to check your vital signs before I do give you medication, if that's okay with you.
Yes.
Just to make sure that everything's okay.
Alright.
So I'm just going to... Yep, so it seems that your vital signs are okay, so I'm going to grab your medication. So here's the buzzer if you do need anything, and I'll be back shortly. Thank you. So could you be my second RN to check the validation of the medication order?
yes, of course.
So here we have Kane Dobson, and I've checked his details against him in his armband. He is allergic to penicillin and has a reaction of face swelling. Signed and printed by the doctor. Today's date, which is also within 7 days, the doctor ordered morphine hydrochloride trihydrate. It is per oral. The dose is 7.5 milligrams to be given 6 hourly. Indication is analgesia. Signed and printed by the doctor, and we can see that it has not been given. Do you agree that this is a valid order?
Yes.
Perfect. So it says here that morphine hydrochloride trihydrate is an opioid analgesic used for the relief of severe pain. Indication: relief for severe pain, not responding to non-opioid analgesics. The contraindications: opioid hypersensitivity, GIT disturbances that can cause constipation. Special precautions to note for patients with respiratory depression and cyanosis. The dose recommended for adults is 5 milligrams orally every 4 hours. Usual range is 5 milligrams to 20 milligrams every 4 hours. So Kane Dobson is ordered 7.5 milligrams every 6 hours, so it's within the safe range. Administration route for Ordine is per oral. Adverse reactions include GIT, upset, constipation, respiratory and circulatory depression, so we have to keep an eye on those. So nursing considerations is to check vital signs such as respiratory rate and pulse oximetry 15 minutes before and after administering the medication.
The doctor ordered medication is morphine hydrochloride. It's today's date, which means it is within 7 days.
So could you come to the drug board with me?
Yeah.
So here we have our morphine hydrochloride trihydrate, and we can see that there's 100 mils in it. So I'm going to do my first drug check with you. So again, we have Kane Dobson, and I've checked his details with him in his armband. He is allergic to penicillin, which is signed and printed by the doctor. So the doctor has ordered morphine hydrochloride trihydrate, which prescribed today's date. The route is per oral. The dose is 7.5 milligrams, but I'll be calculating the dose after. It's to be given 6 hourly and has not been given. Signed and printed by the doctor, and the expiry date is the 12th of 23, so it's okay to use. Now I will do my calculation. So the doctor ordered 7.5 milligrams. The stock strength is 5 milligrams times 1 mil over 1, which equals 1.5 mils. That's my calculation. Do you agree?
Yeah, I agree.
For my second drug check, we have Kane Dobson. I've checked his details against him and his armband. He has penicillin for his allergies, which causes face swelling, signed and printed by the doctor. Today's date, doctor ordered morphine hydrochloride trihydrate, which we have here, morphine hydrochloride trihydrate, to be given orally. Dose is 7.5 milligrams, but we've calculated to 1.5 mils. Has not been given, signed and printed by the doctor, and the expiry date is 12/23. Yeah. Now I'm going to grab my equipment.
Before I start,
And also this is 1.5 mils. Do you agree? So I'm going to do my third and final drug check with you. So here we have Kane Dobson. I've checked his details against him and his armband. He's allergic to penicillin, which causes face swelling. Signed and printed by the doctor. Today's date, doctor ordered morphine hydrochloride trihydrate, which we have here. The route is per oral. The dose is 7.5 milligrams to be given 6 hourly. Signed and printed by the doctor. Has not been given. The expiry date is 12/12 of 2023. And also this is 1.5 mils. Do you agree? Making sure it's locked. And now I'm going to do my documentation.
You want to read it? Anything?
I was just thinking, is this?
And could you sign that for me as well? Thank you.
I'm pretty sure, yeah. It didn't say so.
Hi Kane, so I've got you morphine here, which is for the pain in your chest. But before I give that to you, I just need to confirm your patient details again. So is it okay if you say your full name for me?
Kane Dobson,
And your date of birth?
31st of March 1994.
Yep, and just checking your medical record number. So 0956742. Perfect. And do you have any allergies? Yeah. And that causes face swelling, am I correct? Okay, so I'm just going to sit you up a little bit.
Just do the whole hand rub, confirm and
So this is your medication. I'm just going to get you to pop it in your mouth, and I'll give you some water after. Okay, you might get some reactions of a tummy upset or some nausea, but if you do, just let me know and ring the buzzer. But I will be back in 15 minutes to check your vital signs to make sure everything's okay. Okay, thank you.
So we have our contact and then over here is 09574 and then the 31st of May 1994 and the reference so she's paying England in
Just the penicillin.
okay so what's your reaction to it?
Just some face swap.
Just the medication chart.
It's going to give you your medication.
And could you sign the medication chart for me?
Sorry, can we stop again?
Thank you.
What we should do is